As a registrar in obstetrics and gynaecology, we use gels in our everyday practice. For example, in clinic when we're performing speculum or vaginal examinations, we also use them in outpatient procedures such as hysteroscopies and theatres as well. Any vaginal examination or speculum examination can be quite uncomfortable for the patient and quite embarrassing for them as well. So you'd want to minimise any level of discomfort that the procedure may involve. And the tissue down there can be very delicate, for example at the vaginal entrance. So you'd want to insert the speculum as gently as possible, and the lubrication helps the speculum go in without causing any micro trauma to the tissues there. I would say that this is particularly more pertinent in those older ladies, particularly postmenopausal, when the tissues are very, very delicate there. And just even with the best will, you can cause micro trauma and bleeding. Sometimes if the gel's a little bit cold, because it can be in the store cupboard, I just tend to just hold it in my hand just to warm it up a little bit. And whilst explaining to the patient what I'm going to do, we open up the speculum. And I just tend to pop the whole contents of the sachet on one corner like this, and then put my gloves on. And then I tend to just smear some of the gel around the speculum. Just coat all the surface with the gel, and then perform the examination as you would do. I tend to warn the ladies that I'm using some lubrication, so they may feel wet after the procedure, and that's normal, and explain to them also that I'm doing it to make them feel more comfortable. And then once you finish the examination with the speculum, you just throw it away. But often in gynaecology we do a speculum examination first, and then we go on to do a vaginal examination, so we just continue to use the gel to perform the vaginal examination. It's very important that the gel is sterile to prevent infection to our patients. Obviously in a hospital environment, with all the best cleaning in the world, there is potential for cross-contamination, and single-use sterile sachets minimise this risk to our patients. We've been using water-based lubricants in the UK for many years now. The older style oil-based lubricants can damage polymers, for example rubber gloves or certain other materials that we may use in procedures. I think in this day and age it's very important to use single-use sachets because they're less likely to get contaminated or be exposed to any bacteria, and they're actually quite handy to carry around. So for example, part of my role, I often visit other wards, other theatres, so I always keep a few sachets in my pocket because not every other ward stocks them. So they're very handy for me